Autism Awareness Month. I'm glad you're here today. Our first presentation is on identifying red flags for autism in infant and toddlers at risk and what parents can do to help improve outcomes. We're delighted to have Dr. Jaime DeQuinzio be our presenter today. Jaime has specialized in the education and treatment of individuals with autism for many years. She provides consultation to Alpine Learning Group and is in charge of our research program as well. She's held adjunct teaching positions at Queens College, Caldwell University, and the Chicago School of Professional Psychology. She is a published author in innovative interventions in autism treatment, a collaborator on many projects with me in the area of observational learning, and she is our resident expert in infants and toddlers. So I'll let her take it away.
Oh, thank you, Bridget. Thank you everyone for coming and welcome. I'm really excited to talk about this topic today and hopefully give everybody some really helpful information. And also share some of the things that we're doing at Alpine Learning Group. So what I'll cover today, some of the topics in order, I'm going to talk about what it means to be at risk. I'll go over some general developmental concerns, some concerns that are more specific to autism. I'm going to spend some time talking about what parents can do if they suspect some concerns. And then I'll also provide some hopefully helpful resources for you. And then we'll have some time for questions at the end as well. So to begin, what does it mean to be at risk? You might see some concerning behaviors or some delays. For example, if you have a 12-month-old child and perhaps they're not babbling, or maybe they're quiet. Perhaps you have an 18-month-old who doesn't quite understand what you're saying, or perhaps doesn't, attend very well to you, or just overall some general delays that you're noticing. Those could be usually the most apparent ones are those motor delays, so rolling over or crawling or walking. So those would all qualify, and you might be thinking, if you're seeing those things or things that are concerning, that your child could be at risk. Also, a sibling who already has a diagnosis or a developmental delay or of autism, or perhaps some familial history of developmental delays or autism. Any type of trouble or adverse events that happen prenatally or perinatally, so during delivery. There are some medical conditions that might also be related to developmental disabilities or autism. So things like, epilepsy, or perhaps some hearing or some vision challenges or troubles. Babies at risk or infants at risk also are considered those who have been deprived of, stimulation, or maybe that come from an environment early on that was unknown. So oftentimes in the case of adoption. So here I want to go through some just general developmental milestones and concerns that might come up early in life. I'm going to focus on birth to 2 years. So we're going to really stay early in the trajectory here. So we'll start with about 3 to 4 month old babies. And you may be asking, well, what, that early on, what are 3 or 4 month old babies actually learning at this time? And really at this time, they're learning some really important things about social behavior and about others. They're learning that they're safe, that they can rely on others to nurture them and to feed them, and to provide stimulation. They're also learning that they are loved. So when we know that when babies aren't touched, that they don't thrive. They're also learning what to pay attention to. And very early on here, we know that infants pay more attention to human faces and to human voices than they do any other stimuli. And so these 3 things are indicators of the importance of early social interactions, and really set the stage and the trajectory for all future development. So early on, these social relationships are important for development, and you can see that from the very beginning, babies are learning that other people are important, and other people are important for learning. So here's a video of a 4-month-old, and you can see some evidence of how the baby is attending to faces. So this is a great example of that. And I'll play that one more time because these are short. These are from the CDC website. So in that video, you can see that the baby copied some, not only attended to or was orienting toward the face of the caregiver, but was also imitating some facial expressions early on. Around this age, what are some red flags that you want to look for or be mindful of? If the baby is feeding slowly or not sucking well, if they're not focusing their eyes or watching things that are fairly close to them, if they don't react to, bright lights or bright sounds or loud sounds, if they seem, overly stiff when they're lifted, or kind of the other extreme, overly floppy, if they can't yet support their head, or if they don't smile. So that might be something that's surprising to you, that babies, very early on are smiling and should be smiling. If they can't yet grasp with their fist, if they ignore faces. So if you're, interacting with your baby and they seem to turn away very regularly, that might be a red flag. If they're not making any kind of cooing sounds, and another kind of gross motor indicator is if they're not like pushing down with their feet. So when you hold the baby up and gently place their feet on a hard surface, they should push down. Moving on to 6-month-olds, what are they learning? Pretty similar to what 3-month-olds are learning, 3 and 4-month-olds are learning, but kind of moving along. They start to get better control of their bodies. They can fall asleep on their own. And here you're starting to see some more progression and more that beginning indicators of social interaction and language, the babbling. So that babbling of vowel consonant sounds, and really looking at others and really looking to others more than objects. And you might start to see some individual preferences for things. And here again, you want to see preference for people over objects. Here's a baby showing off her babbling skills. And I'll play this one twice as well. And one more time because it's super cute. And Bridget, I just want to check in with you that you guys are hearing the sound okay.
Yes, we are. Thank you.
Great, thanks. Okay, some red flags around this age, again, are very similar to some I talked about already for 3 and 4 months old. Again, you're still looking at like that over stiffness or over floppiness. By this time, they really should be holding their head up, should be able to sit unsupported, just at least for a few seconds. If they're not responding to noises, or smiling now. If they're not smiling when they see the caregiver come over, we start looking at red flags here that are more social in nature. One big indicator is that there might be an issue is that they're not affectionate with their caregivers, or they don't seem to be soothed by affection, or they don't seek out affection. They might have difficulty getting things to their mouth. If they're not making those babbling sounds and those vowel sounds that we saw the baby do in that video, if they're not rolling over, and really at this stage as well, you should hear some laughing and squealing and pleasurable noises. So if they're not doing that, that is also considered a red flag. Moving along, between the ages of 6 and 12 months, what are babies at this stage learning? They're learning social skills, imitation and turn taking and sharing. Sharing more, think about sharing as like showing or giving objects to adults in their environment and familiar adults. They start to make some intentional sounds and gestures to refer to people and things. They can express their emotion and show affection, so hugs or rubbing their faces against your face. They show some interest in toys and playing with toys. In terms of motor development, this is where you'll start to see some crawling, and if babies are pulling themselves up, creeping, and some babies, even start walking between this time. And then the final thing is object permanence, which is a cognitive skill, which is really about understanding that when things are removed or hidden, that they still exist. That's really just starting to develop at this time. So you want to see that the baby will look for something after it's hidden. And they're really starting to explore eating, a variety of different foods and textures. Here's a cute, we talked about social interactions. And so here's a baby around 9 months playing peekaboo. Notice how the baby looks for the recurrence of that game and the repetitiveness of that game and wants to find the adult or caregiver under the blanket.
Get me. Hi.
I'll show it one more time.
Get me.
And this sure was after multiple times of doing it over and over again. Some red flags around this time if they're not showing joyful expressions, if they're not smiling at you. By this time, if they're not responding to loud noises in their environment, it's that's something you really want to follow up on and pay attention to. If they're not showing interest in faces at all or avoiding faces, so you'll see a lot of these themes are recurrent within that first year. If they're turning away from eye contact, if they're stiffening and crying when held by their caregivers, and really by 7 months, if you're not hearing any babbling, that is a big red flag. If they're generally quiet baby overall, between 6 and 12 months, that's a red flag as well. At any time from this point on, if you see a loss of skills, so perhaps they were babbling and they were cooing and they were making some sounds, and now it seems to have gone or disappeared, or they're not doing it as much, that's a red flag and something you definitely want to pay attention to. Facial expressions, flat affects, overall generally not interested in other people, not looking or making eye contact, not using gestures. Again, this kind of, we just keep coming back to kind of the social piece and the physical piece of, not wanting to cuddle and here around this time, around 12 months, babies really can start consoling themselves and be consoled by their caregivers if things are going on for longer periods of time. Then that might be a red flag as well. So if they're not able to be consoled after, 20 or 30 minutes, then, and this happens consistently, right? Not just once or twice, but consistently. Around this time, they really are attempting to imitate sounds and movements of the people around them as well. So if you're not seeing that, that is another potential red flag. What do they learn around this time? Similar to what they've been learning all along, but even more importantly, that people are more important than objects. If something goes out of sight, it still exists. They're learning to make more intentional sounds and gestures to communicate. You might start to see some personality here and, a sense of humor. So they are laughing at things that you're doing. They know when things are funny or silly. They look at adults for information and for emotion. So, and they want to share experiences with adults, right? So then, we're really looking to see here, joint attention is starting to become established or might already be established. And also what we refer to as social referencing, where they look at the emotions of the adults around them to know, how to respond. How to use tools, and they start those beginnings of pretend play. Maybe they can imitate you, pushing a car or holding a banana up to your ear and saying hi, and or hugging a baby doll. And that still at this time, separation from parents is hard. So that's not a red flag at this point. So if your baby's having a hard time when you leave, that's completely developmentally appropriate around this age. Moving along to 18 months. What are they learning to do at this time? They're pointing, and they're often wanting even more to share experiences. So by 18 months, they really have a well-developed joint attention repertoire and social referencing repertoire. So they look at things happening in their environment and they look back at their caregivers to share that interaction and to see, oh, did mom see that? And then maybe, again, look back at the special event that happened in the environment. So they want to see the reactions of others around them. They're interested in seeing the way people around them are responding to things in the environment. And also checking in when something's unsure, where they're unsure about something, and looking at the emotions of others to guide that, how they respond. Something that I mentioned in the last stage around 12 months that's developing, but really by 18 months, this is really part of their repertoire. They enjoy adults and they enjoy attention from adults. They notice how adults feel. They want them to be happy. They like to help. So around this time, you might start to see some little helper behaviors. So, helping you, take the laundry out of the dryer and put it into the laundry basket. They can imitate simple actions. So if you, do some simple actions with toys, they can do that as well. They're understanding words and instructions, especially around daily routines like get your shoes, or, where's your shirt, as they're getting dressed, or, where's your belly, things like that. They can use gestures. They can make some choices. Pretend play is developing, and they like to show off new skills. They're proud of themselves when they do something new, and you know that because they're looking at the reactions of the adults around them. Here's a baby at 1 saying some words, trying to say the words that the adult is saying.
Dante. Thomas. Daddy. Dante. Daddy.
I'll play that one more time.
Thomas. Daddy. Dante. Daddy.
Okay. And then I have an 18-month-old, just because I talked about both here in this section, looking at 18-month-old using gestures.
No.
To indicate no.
No. Can you give him the truck? No. No, Dada. Can you give him the truck?
They're so cute. Watch these all day. One more time.
No.
No. No. Can you give him the truck? No. No, Dada.
And again, these
Can
are
you
right
give 'em
on
the truck?
the CDC website. Lots of great resources there. I'll come back to that again later in our resource section. What are some red flags by 18 months? They're not pointing or showing things. They can't walk. They don't know what familiar things are for, how to use familiar things like fork, for example, in terms of feeding. They don't copy others, just generally not interested in the behavior of others. Perhaps they're not gaining new words. If they don't have at least 6 words by this time, especially familiar words, so people in their environment, the most familiar people in their family or even pets, that should be part of their initial words. If they don't notice or mind when a caregiver leaves or returns, so remember earlier we talked about, that it's appropriate around the age of 12 months that they still might get upset when their caregiver leaves. Here it still is as well, but even more of a red flag here is that if they don't seem to notice at all. And again, this is really consistent, from the 12 months on, if they start to lose skills that they once had. And then, going up to age 24 months, what are they learning? What are babies at this age learning? They're interested in learning new things like dressing themselves and feeding themselves. You might start to see some push for independence. They want to do it by themselves. They can imitate more complex responses. So notice that these things are all related to learning from others, right? What we talked about early on. Getting better at pretend play, showing off things they've learned. There's some self-centered play. Again, they're starting to show some independence here and not constantly copying or relying on others, but you see how important, the early establishment of that is for now this later independence to emerge. They are, by 24 months, they know all their body parts. They can understand complex language. Okay, it's time to get in the car. It's time to go to the store. They might go get their shoes without you saying get their shoes. They can follow some directions without gestures, like I just talked about before. That would be an example of that too. You start to see them combining some of these words that they've had into phrases. So mommy go, or get ball. They start to show a sense of what's theirs by saying my or mine. They know what's theirs and what's yours. You see some determination here, some problem solving, and that's really an indication of the cognitive growth. They understand sequence and order, and sometimes they pretend to be an adult. So you might see them doing things that you do on a daily basis, like, brushing your hair or brushing your teeth, okay? Here's a great video, an example of a 2-year-old, some expressive language saying 2 to 4 words.
I shot a hoop.
You got it in the hoop?
I'll play that one more time.
I shot a hoop.
You got it in the hoop?
All right. Red flags around this time is that they're not using 2-word phrases like drink milk or mommy go. They don't know what to do with common things that you use every day in everyday routines. They're not copying actions or words or following simple instructions. Really, the gross motor skills are pretty well developed here. You might even start to see them starting to learn how to run by 2, so if they're still not walking steadily, that's definitely a red flag. And again, as always, if you see any loss of skills, it's something that should alert you. So those were some general developmental concerns, and now I really want to highlight some concerns that are specific to autism. And you might see some overlap or repeat of things I said before. A lot of this information comes from some scales that have been developed in recent years for identifying red flags in autism or kids at risk for autism very early on. So we have the Autism Observation Scale for infants, and that is can be done as early as 6 months. And then we have the ADOS or the ADOS, the Autism Diagnostic Observation Schedule. There's a toddler version of that, which can be completed with babies as early as 12 months, as long as they can walk. The toddler module can be conducted. So I want to highlight some red flags that are in the Autism Observation Scale for Infants, or the AOC. One thing that is looked at as a red flag is the baby's ability to visually track items. So you remember when I was talking about just overall babies responding to things in their environment. They look at disengagement of attention. So can the baby focus on something and then stop focusing on that one thing in the environment and then focus on something else? Usually that's done with something that is visual stimuli or sounds. So like shaking a rattle on one side, stopping it, shaking a rattle on another side. Orienting toward name, responding differentially to facial emotions. So this can be done, with 6-month-olds, and you saw that a little bit in the video I showed earlier, where you might smile in an exaggerated way at a baby, and they smile back, and then you just really flash quickly to a neutral expression or a sad expression, and babies will change their expression as well. So that is actually something that would come up as a red flag if we didn't see that. Anticipatory social responses, so kind of these cause and effect anticipatory responses, like in peekaboo, for example, or in little games like I'm gonna get you, where you pause and you wait, and maybe the baby has a response, for example, like looking at you or smiling or vocalizing. That's an anticipatory social response. So if we're not seeing that, that's a red flag. The inability to imitate simple things. So the way this is tested in infants around 6 months is using motor movements of the mouth. And then, if you're testing a baby who's a little bit older, so 18 months or older, you can use, simple actions with objects. So that's another red flag. Some social babbling is kind of, back and forth babbling. The baby vocalizes, the adult vocalizes, and then the baby vocalizes again. So you want to look at reciprocity of the vocalizations. And if you're not seeing that, that could be a red flag as well. Eye contact, of course. Reciprocal social smiling. You smile, the baby smiles back. We talked about before the joint attention and coordinating that eye contact and gaze. Overall behavioral reactivity and overall responsiveness to what's going on in the environment. So if we see a baby who's generally unresponsive to the things that are happening around them, then could be a red flag as well. Overall, just social interest and shared affect with things. So this is kind of similar to behavioral activity, whereas behavioral activity, you're looking at responsiveness to events in the environment. And this one, with social interest and shared affect, you're looking at them just overall being interested in the emotions of others. How easily they transition if they have difficulty moving from one activity to another. Overall, their motor control, if they're not directed or organized or well modulated. Any atypical motor behavior, for example, the way the baby, the gait if the baby's walking, any kind of mannerisms or postures. And here we could also see any repetitive motor movements or tensing or arm flapping, posturing of the face. Of course, those would be red flags as well. Any atypical sensory seeking behavior, so smelling, staring, feeling of textures. If we see, a challenge or inability for the baby to focus their attention on a range of objects, and again, this has to be, appropriate for the age. So if you're testing or looking at a really young baby, you might expect less than if you were looking at, for example, an 18-month-old. Any insistence on specific objects or activities. So, only being interested or only showing attention with, one type of object. So maybe round objects or things that, vehicles, for example, things that can be pushed. And overall, just looking at, any deficits in sharing interest. Using, this is similar to what we were talking about before with eye gaze, but using their eyes to reference and share interest in an object or event with another person. If we're not looking at that, if not seeing that, that could be a red flag as well. These items in this list are currently, used in research. So all of these can be found in a bunch of articles by Bryson and colleagues, and I have them listed later on. But really, this isn't really being used in clinical practice yet, but they're definitely things that, help us as clinicians orient us towards some red flags. I mentioned before the ADOS, the toddler module specifically. You can see, I won't go through all of these, but There are items in there that can be indicators of red flags for autism in the areas of communication, reciprocal social interactions, and the presence of restrictive or repetitive behaviors. And so with the toddler module of the ADOS, that almost is a way to assess red flags, because the outcome of the toddler module is that you are looking at what is the level of concern here, or should you be concerned about autism. So this one is used in clinical practice and can be actually an effective screening as well as a diagnostic tool. Okay, so now that we've gone through what some general developmental concerns or red flags could be, and some more that are specific to autism, what do parents do? What can you do at this point if you are suspecting or seeing some of these red flags or suspecting some delays? First and foremost, number one, track your child's development. And the CDC has an excellent app where you can download this and you can track your baby's milestones from birth to 5 years. And so you don't have to, after this talk, go and remember everything, or, be following or reading the lists or the slides here, but you can actually have it right on your phone, ready for you, and looking at what your baby is and is not doing throughout development. Number two, you can screen your child yourself, and it's free. And it's called the MChat. And, it's not that early in development. It's 16 months. And some of you may think, wow, isn't 16 months early? But, now that you've heard this talk and you've seen that the earlier the better, this is a little lacking. But if it's 16 to 30 months, you can screen your child yourself. Autism Speaks has the MChat right on their website. You can go through it, and at the end, you answer the questions, and at the end, it tells you what level of concern you should have and whether or not you should seek an evaluation for your child. And if you are concerned, if any of these red flags are showing up, you have the power to jumpstart therapy without having or seeking professional help, or while you're waiting for professional help. Sometimes it takes a long time. There are waiting lists for evaluations and assessments and for starting interventions. You as a parent have the power to get started. So I'm going to give you just a few ideas of some things you can do with your baby or your toddler if they're showing some of these signs. For really young babies, tummy time is very important, and not only because it helps with the the motor development of their neck and the control of their head, but also as a social time. And a lot of there's some recent and developing research that has shown that tummy time can be a social time, and that babies enjoy tummy time more, or more likely to stay in tummy time, have longer durations of tummy time, if it's done on the parent's chest. So you can see, this is just a little example of a picture of the baby on top of the mom's or the parents' or the caregiver's chest. And not only is the baby learning and building and strengthening their neck muscles, but there's lots of opportunity for social interaction here. Eye contact and cooing and vocalizing. Another thing that you can work on with your child is looking in response to name. So if you're worried or see that your child is not responding to their name, you can do this in the context of some play activities. For example, completing a puzzle, or you might have, or even during feeding time, you have something the baby wants or needs, and you call their name, and you wait for them to look in your direction. And then once they do, you can provide that item or that they wanted. There are all sorts of types of prompts or ways that you can get the child to look at you. So if you have, using these objects, if you have something that they want or need, for example, in the context of feeding, you can bring that spoon to your face and call their name. And when they look at you, you can feed them. So that's just one example. And I have some videos later on that will show some examples of these. Just that looking at others is meaningful, and this you can do within the context of play too. Those fun social games like tickling, I'm going to get you, or or peekaboo. So you can, or, singing songs like the Itsy Bitsy Spider. So if you're doing any of those things, you pause them, maybe pause like right in the middle, or make it very obvious that you're pausing this activity, and wait for the baby to look at you. And then once they look at you, resume the social activity. And again, here, if they're really having trouble or struggling to look at you, you can use some things to prompt that, so you can get in their visual fields. You might be able to use, commonly used in interventions with babies, as a finger swipe, or some way to, some object they're interested in to help track up to your face. You can start teaching your child to follow simple commands. So it could be something, related, or using objects like, having a little bucket of shape sorters and just saying put in, and then gently guiding them to do that, and making a big deal, and, praising and tickling and things like that when they do. Or it could be, something like get your shoes, and the shoes are right next to them, and it makes sense because you're about to go outside and play or leave the house. Similarly, you can teach simple imitation. So sometimes this might be easy to have your baby in the high chair, or in a booster seat, or even in one of those little, activity seats. And you might do something like I said before, put a block in a bin, or stack a block, or, tap a stick on the table, or shake a maraca, and then gently guide your baby to do what you do. In the area of language, encouraging vocalizations, one important thing is just to make sure your baby hears lots of words. And you can do this by reading to your child often. It's never too early to start reading. As early as, newborn babies. Sometimes it's hard to know what to say, or what should you be saying. And, books, age-appropriate books, provide just a great avenue through which you can talk to your baby. Label things you're doing, label things that they're doing, label objects in the environment. So as much as you can, make sure your child's hearing lots of words. There's also some great research in this area of imitating your child's vocalizations as a way to encourage reciprocity and increase babies' vocalizations themselves. So if your baby, even as young as, just a couple of months old, if your baby's making cooing sounds or starting the babbling, kind of get in their space with them and imitate the sounds that they're making. And be sure in this activity to pause and give them the chance to continue to do it as well. Don't kind of take over that interaction, but be sure to, you're imitating what they're doing, but also giving them the chance to continue with the vocalization. And then to also complete simple activities, or to engage in some play and leisure skills. So it could be, finishing a puzzle, those big knob puzzles, or the big chunky block puzzles, or, stacking blocks, or putting objects into a bin and taking them out. There's all sorts of activities, stacking rings, all sorts of activities that early on you can teach your baby to engage with. Just some tips, if you are going to, work with your infant or toddler at home, is to really don't stress about it, and really just try and have fun with it. Work it into your everyday routines. You're going to bathe them anyway. You're going to change their diaper anyway, or get them dressed, or, feed with them, or, you're going to play with them anyway. So work these activities into your everyday routines. And think more about having meaningful moments than, oh, I have to sit down and do a play session with my baby, or I have to sit down and do a session where I work on my baby responding to their name. Find the moments in these everyday routines and work them in there. During play, and I already said, have fun and just be silly and enjoy. If you start feeling stressed about it, they might pick up on that or then, you know, it's not fun anymore. And then it becomes challenging, and maybe then you're even less likely to do it or even get the responses that you're looking for. And of course, seek help, right? So, my final tip will be about reaching out and getting some professional consultations in there. But before I do that, I just wanted to show a few videos that highlight some of those activities that I just mentioned. So this one includes a few ways where you can work on getting eye contact with your child, your young child. You'll see a few examples. One is, you know, bringing a favorite activity like bubbles up to your face, and once the child looks, then you activate the bubbles. Another is, you know, simple games like peekaboo. The last one you'll see, which I like a lot and I referred to before, is kind of getting your child to look at you to gain the recurrence of an activity. So you're doing something fun, like they're swinging on the swing, and you abruptly pause it and you wait for them to look towards you before you resume the activity. So I hope, Bridget, if you can let me know how this is coming through on your end, and if it's not going well, then hopefully my explanation helped there. And I'm just going to move a little forward to, I really like this video. She does a great job doing all these different things
up next to
get
your
eye
eyes.
contact.
This will draw your child's
Do you have sound
attention to the
on your
object
end, Bridget?
and therefore your face. Don't give the child
surprise.
the object until they have given you eye contact.
Great. So that's where she kind of brought it up to her face and waited for eye
Using something
contact.
bright, colourful, or a bit silly on your face will encourage your child to look at you. Play peekaboo with your child. Use different objects such as a scarf or your hands to cover your face.
What I liked about the silly glasses one is almost like, you know, it's for those behavior analysts that are looking or listening today. Those are like stimulus prompts, like how can I draw my child's attention up to this area? And, you know, using things that are interesting to them can be helpful.
Allow your child to pull the object away and then say,
Peekaboo,
boom.
of course, is a great way to get the child to orient towards your face.
And you find it. Blow up a balloon with your child. Wait for your child to give you eye contact before you blow it up a little bit more each time.
And this is that one example of, you know, kind of pausing and waiting for them to look before you resume an activity.
You can also
Here's
practice
another one.
eye contact at the playground. Prepare your child for a swing, but don't let them start swinging until they look at you.
Ready?
There she goes. She waited, paused, and then the child looked. And then she gets to go again. This video shows an actual therapy session, but what I liked about it is it shows an example of what I was talking about before. So getting the child to respond to their name so that they can get access to something they want. So they're doing that within the context of completing a puzzle. I'll just show a little bit of this.
To encourage Ethan to respond to his name, we condition him to anticipate receiving something he likes whenever his name is called. Here is an example.
Ethan! Nice looking! Ethan! Ethan! Looking at me. Nice looking. Good job. You looked at me when I called your name.
So I won't show that whole thing. It's pretty long, but there's a few things I want to highlight from here that I really like. You know, when you're working with infants and toddlers, you know, whether it's your own child or if you're a professional doing so, it's really about being down on the floor and in play situations. The other thing I like that she did was use the object as a way, again, as a stimulus prompt to get the child to look up, because you might have to embed some prompts in there to start with. And then over time, you know, kind of fade those out. And then the last two videos I have here are just parents having fun with their babies and showing some nice examples of just taking a couple minutes out of a daily routine, something you're going to do anyway. The first one is a mom having a conversation with her baby. So she's not necessarily imitating the baby's exact vocalizations, but you'll see the reciprocity here where the baby coos and then the mom, talks, and then the baby coos again and the mom talks back. Again, I'll just show a couple of minutes of this, or less than a couple of minutes.
Tell me about it. Really? Oh my goodness. Oh my goodness. Are you feeling better? Oh.
That's a pretty vocal baby. But again, it's a great example of that reciprocity and vocalizing back and forth with your baby. And this video is internet sensation. This video has gone viral, and many other videos that this dad has posted with him and his baby having conversations. So a few great things here to pay attention to is, again, that reciprocity is the dad gives the baby an opportunity to vocalize back. There's great examples of eye contact here and gesturing and orienting, and it's really funny too. So I'll let this play.
Okay. They need to work on that, right? Yes, okay. Did you understand it though? No. Okay. All right. Huh? Oh, no. Not this one. This is the grand finale of this.
Oh, look at that. We got imitation and with the gesture.
That's what I was wondering. I don't know what they're going to do next season because they did some stuff this time. Exactly what I was thinking. Oh, yeah.
Hopefully that one made you laugh and smile. So that's another great example of just like interacting with your baby during something you're already doing, even something like watching TV, right? Watching your favorite, game on TV. All right, so the fourth step that you can take is then to schedule a formal evaluation. And again, kind of starting and jump-starting that therapy on your own at home can be done to bridge the gap. There's an issue, there's some delays, you're seeing some red flags, reach out right away, don't wait. I didn't mean to say you should wait, but in the meantime, you can start these things on your own. So you could schedule a formal evaluation with a pediatric neurologist, a licensed psychologist, developmental pediatricians, speech and language pathologists. You can also contact your state early intervention, which you can find on, depending on, where you live. I'm not sure if everyone here is from New Jersey, but you can just Google, your state and early intervention. Also, just a good idea to be informed about your own insurance and your own insurance program, whether it's a government program or if you have private insurance, just kind of what the rules are in terms of, what gets funded and what kinds of assessments are required. If you do move on to a diagnostic evaluation, here are the four kind of things that are part of a diagnostic evaluation for autism. And these are the things that we've seen that insurance companies are requiring. So I just like to, kind of let parents know that if you go in and you get a diagnosis and that report does not include all four of these things, that it's often likely that your insurance company is going to ask for more or ask for all four of these things to be included. An assessment that looks at autism symptoms specifically. So in the ADOS, the ADIR, which is an interview for parents, a CARS or a PDDBI. So those autism specific assessments. A developmental assessment, if the child is young, 5 or under, they'll want this. Some of those are called the BDI-3 or a Mullen. An adaptive assessment, so that looks at just daily functioning daily skills that are used for functioning. It does include expressive and receptive language. This is usually an interview that is, or a questionnaire filled out by a parent or caregiver early on, or later on, sometimes a teacher. A cognitive assessment. So early on in early development, this is usually part of any developmental assessment. But later on, and once the child is, between 5 and 7 and older, which of course I'm not focusing on today, but just so you know, that a cognitive assessment like a WIPSI or a WISC. The behavioral piece, if you have behavioral concerns, that piece is optional, but there are some behavioral assessments out there as well. Once you have a diagnosis, or even before then, the next question might be, how do I access services? Again, I'll start with that early, contacting the state, early intervention. If you have a diagnosis and you're ready to move forward with insurance-funded ABA is the way to go, of course. This does require a prescription from a medical doctor, plus the diagnosis, and the diagnostic report more often than not includes those 4 things that I just reviewed with you. And these 2 things can come from different professionals. For example, you can get a diagnosis and a full comprehensive evaluation from a non-medical doctor, so a licensed psychologist or speech pathologist. Some do full diagnostics. But then the actual prescription for ABA, for example, if that's what's recommended, has to come from a medical doctor. So sometimes parents will take that report and ask their, pediatrician, they're just their regular pediatrician, to write the prescription based on the recommendations specified in the diagnostic report. The minimum prescription, and we know this from many decades of research, is 25 hours. But of course that can vary depending on severity and whatever the professional recommends. Once services begin, ABA services begin, you want to be looking for that the agency or the service provider is conducting a skills assessment. And those, can take various formats. There are many that are out there. These are just a list of a few: a VB-MAP, an ABLS, a PEAK, an AFLS, an EFL. If there are concerns about problem behavior, if your child is showing problem behavior, you want to make sure that those service providers are doing function-based assessments and really developing interventions based on these assessments. You really want to look for a parent training component, right? Especially early on when they're young and they're spending most of their time at home with their caregivers. So advocating for that when you're accessing services is an important piece. And of course, that these services are provided by and supervised by credentialed professionals and appropriately licensed people. And in behavior analysis, those are board certified behavior analysts. I want to have time for questions, so I'll go through just one more minute. Some resources for parents, and we can make this available, I think, Bridget, also on our website. Autism New Jersey is a great resource for parents. Autism Speaks as well. The CDC Developmental Milestones. This wonderful book by Deborah Fein and colleagues, The Activity Kit for Babies and Toddlers at Risk, chock full of wonderful activities you can do with your baby or toddler day in and day out. There's some great videos on pathways.org that show a lot of these developmental milestones that I talked about earlier today. And of course, Alpine Learning Group. We are a resource for you. So please don't hesitate to contact us. I'll put that up. This is our contact information. I'll put that up just for a minute. And then I want to just go back and talk to you about some of the services that we offer at Alpine Learning Group. In this area of early learners and babies, we do provide, and we do have autism and screenings, and specifically for babies at risk or infants at risk that already have an older sibling with autism. We do provide consultations. We do have diagnostics from age 12 months to 7 years, insurance funded in-home ABA, and parent training. In addition to what many of us already know us for, which is our school-based and program and adult program. These are the services that are really related to what I talked about today. I'll go back to that contact slide and then I'll open it up for questions.
Thank you, Dr. DeQuinzio. That was great. I love the videos. So sweet.
Thank you. I'm glad they came through on your end, so that's great.
You do have the capacity to unmute if you have any questions. You can also chat in the chat box. We have a few minutes left. We can answer some questions.
Or comments.
Jamie, can you clarify that the early intervention evaluations are free, correct?
Right, if you're going through the state, absolutely. Yep, that is at no cost.
And should doctors be screening babies for these milestones?
That's a great question. And yes, pediatricians are screening babies for general overall milestones, but they might not be looking at autism specific markers like the ones I spoke about today.
Is
so,
my pediatrician,
you know,
is the pediatrician a good resource for them?
I think they can be, depending on what their knowledge and their skill set is. But if you're finding that they're not, if you have some concerns and they might, you know, I think sometimes pediatricians don't want parents to panic and they don't want to alarm parents. But if you have a child who's at risk for, especially if they have an older sibling with autism and there's a history of autism in your family, you know, we kind of go with the idea of why wait, and you know, there's, you know, time is of the essence, and if you know and just have a little clue or one small concern, it doesn't hurt to reach out to some professionals who are more autism focused and more expert in the autism area. So for example, Alpine Learning Group, we are happy to provide those resources and more information.
There's a question about the availability of resources to help learn how to copy emotions, you know, how to go about knowing exactly how to provide those, you know, interactions.
You're right. There isn't a lot out there in terms of resources for parents that's available. You know, we can provide parent training at Alpine Learning Group, but I think the most important takeaway from today is to, you know, engage with your baby and your toddler as much as you can. And if you see that your baby or toddler is not responding to your emotions, one tip is to exaggerate those even more, and, you know, make them more salient and make them just, again, more exaggerated. And then, you know, kind of work from there. And if you can even get their attention for a little bit with something like that, then that's the first step. You know, we can perhaps post some resources on our website, Bridget, for parents. But again, there isn't a ton out there directing parents what to do. I did put up some of these resources here. So the activity kit for babies and toddlers is excellent. And they have some great ideas in there in this area. And then this pathways.org does as well. Those are more videos. So
and I think there's lots of videos if you YouTube, you know, interactions with babies or imitating babies. You'll see some parents doing that with their children, which might be a good model. There's a question about whether there's an assessment that could be done prior to an MChat, like a pediatrician might use an MChat. Is there anything that's out there and available before the use of an MChat?
That's the one that that the pediatricians are using, and there was a big push for that many years ago. And it used to be older, but now they've, you know, in the most recent version, it's come down to 16 months. But as you see, there's still some room there. There's still, you know, 0 to 16 months to look at. But at the moment, no, the AOC, the one I shared with you, is the one that's being used in the research, but not clinically yet. So again, it's really a, you know, parents and caregivers to be looking for these red flags and to be looking at these signs and bringing it up and really being the advocate and pushing and going elsewhere if you're not getting the answers that you're looking for.
I misunderstood the first question, that one of the questions that I asked about helping with emotions, and this parent is saying, how can they get emotional support trying to help their child and deal with grief?
Okay.
I will say that we do have a really great video on our YouTube channel posted, a presentation by Dr. Kate Fisk, who is at Douglas Developmental Disability Center, Rutgers University, and she does a lot of work in the area of parent stress and coping. And she has a great book called Families of Children with Autism. I think that's the name of it, but it has to do with families who, you know, what their process is like. And in that book, there are a lot of resources for families and also for clinicians to understand the grief process that families might be going through. So looking at that video as a first step and then seeing what resources she mentions on in that talk.
That's great. I should add that here, Bridget. Thank you for, I'm glad that question was asked and I'm glad you thought of that.
Any other questions? I really thank you for your time today, everybody. It was great to have people at this presentation. You probably got the email that there will be 3 more presentations, so please stay tuned for those. And we look forward to seeing you at those presentations as well. And if you have any other questions, feel free to give us a call at the number that's provided on the slide.